Hey guys, Dr. Derry here, owner of Revision Health Services here in Jacksonville, Florida. And today I want to go over what I do with all of my lower back pain patients when they're saying, should I stretch my lower back? What stretches should I be doing for my lower back? And how do I do them? Okay, so I want to go over my top three stretches to really hit the entire spine. We're talking upper back, lower back, how to move them, make them feel better. Our body craves this movement. Let's learn how to do it. If you want to know, hang with me and we're going to go through them. All right, guys, so I'm going to go over my first and probably favorite lower back, upper back stretch, in that we know that the lower back has a natural curvature. It's called lordosis. And we know that the upper back has what's called kyphosis. It's a little bit of rounding. And what this does is it really allows you to help get a little bit of that rounding in the upper back to kind of move in the other direction to feel better. And that's really the premise of stretching, is kind of moving the muscles and joints in the areas that they're made to move. And so I want to go over my very, very favorite standing upper back slash lower back slash leg slash calf stretch. It hits everything. And depending on how stiff you are, different areas will dictate the different areas that you feel it. And so I like to do this standing because it's more applicable to your life. You can do this anywhere. So I recommend an elevated countertop or just actually a normal height countertop. And so anything you can do to get your hands on, and it can withstand some weight. And so I've done this on the back of couches, countertops, desks. And so I've used it in many, many areas. You can do it in many places. You can also do this on your hands and knees, and there's a variation of the child's pose or prayer stretch. And so it's a variation of that, but this one really allows you to hit that upper back really well, the lower back as well. And it just gets a good stretch, good joint mobility. It kind of hits everything. And so I want to start off with this. All right, so you can see that I'm using an elevated surface here. And again, this would be your countertop. You're going to stick your butt out. And what you don't see is that I have a little bit of a soft bend in my knees. And what that means is they're not straight, they're not bent very much, they're just unlocked. Toes pointed forward, unlocked knees, and I'm going to sink back in between my arms. And I'm going to feel this stretch a lot in my lower back, my upper back, as well as maybe into my arms or my calf or my hamstrings, the back of my leg. It hits a lot of areas. And so by what I mean by sink into it is that you're going to have your hands planted nice and firm. You're going to breathe out, sink into the stretch. And then if you want to feel it even more, if you want to feel it really, really well, you're going to want to put some pressure from your neck into your upper back. And you're going to do what's called this retraction. You're going to come back. So when I'm down here, I'm not going to let my head hang down. I'm going to come up and I'm going to come back, not up, back. Okay, back. And that really, really allows me to hit that part of my neck that I really, really feel when I've been sitting too much throughout the day. So let me know how it goes. You should feel it maybe in your neck, upper back, lower back, the side of your arms, hamstrings, calves. Lots and lots of areas. You can breathe into that stretch and you can move in and out of it, or you can get there and hang out. It's really up to you. My favorite stretch. So again, this is what it looks like. As you can tell, I'm not rounding my back. I'm poking my butt out. Okay. You can pretty much do it in any clothes too, right? I got my fancy clothes on today for fancy stretching. And so try that stretch out. Let me know how you love it. And if I miss anything, please let me know too, but it should feel good in 99% of people. Let me know. All right, guys, so we're going to go over my second favorite stretch. And so this stretch is for people who have a tight lower back specifically. So really like the lower portion of your back, this portion right here, it feels stiff, achy. It's just kind of always there. And you're always kind of looking for ways to stretch it. So you're going to be on your hands and knees. You're going to spread your knees apart a little bit. And a lot of people are familiar with just sitting down and going into the stretch here. And so what I like to do is let my hips sink in between my feet. So I spread my knees apart to feel that. It's a great stretch. But what I will tell you is that when I add this little caveat, people really notice the difference. So What I want you to do is your hands are going to be underneath your shoulders, knees underneath your hips. You're going to do a little bit of a tuck of your pelvis. And so really it's just a contraction of the abs to round out your lower back. You're going to round it out and gently sink down. And that is the lower back focus. Okay. Again, extension, flexion. You're going to really flex, flex, flex. You're going to sink down. And then it's the lower back focus. You can hang out there for a bit. You can do a couple breaths. Yes, it is like a yoga move. Yes, it is called a child's pose or prayer stretch, but you're adding that what's called a posterior tilt. And that posterior tilt is really, really effective for hitting that lower back specifically. Now, if you're like, Michael, my knees hurt or my hips hurt when I go back and do that, then you have the option to do the stretch that I just went over previous to this, but the standing L stretch or the standing prayer stretch. And that allows you to hit that area as well. So try that out. Number 2, stretching for my lower back pain patients that really feel that stiff achiness, that prefer that little bit of rounding in their lower back. Try it out and know you're going to love it. All right, guys. So we're going to go over the last stretch here, and it's really a mobility stretch / strengthen / it feels amazing, but it's a little bit more complicated. It's called thread the needle. So you're going to be on your hands and knees. You're going to reach one arm under, and then you're going to come up to the ceiling with that same arm. So you're going to be on your hands and knees. So in this case, I'm going to stabilize with my right hand to reach through with my left, and then come the opposite direction and reach up. I am not the most limber physical therapist out there by any means, but you're going to come up. So where I feel this is a good stretch in my lower upper back. I'm coming up. I feel that tension as well. Oh, my back just popped. That's a great thing. Felt amazing. So again, hands underneath shoulders, knees underneath hips. You're going to reach through underneath the other arm. Reach, reach, reach. And then you're going to come up and reach towards the ceiling. Now, this one's different than the other ones is that I don't really have people hold there for too long. In and out. So breathe out, just keep moving. Motion is lotion, baby. So you've got to keep those joints in your back moving. Great. Upper back, lower back, hip, kind of a little bit of everything stretch. It gets the system warmed up a little bit. So we've got the standing L stretch. We've got the posterior tilt into the child's pose or prayer stretch. And then we have what's called the thread the needle. A little bit more advanced, but also very, very effective. And it should be safe for most, but listen to your body. Until next time, just stay moving, take care of yourself, try out those stretches. And if you have any questions or concerns, feel free to reach out.